Hello and welcome to Health Q channel, the health awareness channel where our mission is to motivate you to look at the brighter side of your health. As usual, I am your host, physiotherapist Meghana, and in today's video, we are going to talk about posterior cruciate ligament injury. Have you seen that video? Anterior cruciate ligament injury? If not, make sure you watch that video first, because posterior cruciate ligament is a typical similar kind of injury that happens following the damage to this particular ligament named as posterior cruciate ligament. How the anterior and posterior cruciate ligament are different? Well, as the name suggests, anterior cruciate ligament is a ligament that's lying in the front side of the knee joint, whereas the posterior cruciate ligament lies on the back side of knee joint. Now, the function of both of these ligaments is to hold the knee joint stable. It connects the bones, two bones, the femur bone, also called as the thigh bone, and the tibia bone, also called as the leg bone, together and keeps it holding. Whenever there is any kind of walk, shear, strain, etc., these two ligaments are responsible for holding the joint at its place. So, whenever there is damage that happens to any of the structure, the biggest thing will happen, that is instability of the knee joint. In particular, posterior cruciate ligament stabilizes the knee joint in back-to-back or else front-to-back forces. For example, posterior cruciate ligament prevents the leg to slip off much far in relation to the upper leg. For example, in activities like walking, when we are raising our leg and keeping in front, it's the role of posterior cruciate ligament that your leg do not go too far and lands in a correct place and puts the proper weight in your leg. When the joint is sprained following and fall with the knee bent position. Sometimes when knee hits the dashboard while in accident, whenever a person falls, whenever an athlete falls following a play activity like football, tennis, basketball, etc., especially in the knee bent position, at that time the posterior cruciate ligament is injured. Now, the typical symptoms of posterior cruciate ligament is again swelling in your knee joint, pain in your knee joint, especially in the back side of the knee, on the sides of the knee when the pain is experienced while running, especially during the slowing down. But typically, the patient with posterior cruciate ligament will not experience pain immediately or might experience pain after 2 or 3 weeks following a fall. Due to this reason, sometimes the posterior cruciate ligament gets unnoticed or else is not diagnosed correctly. Hence, it's very important that whatever is the fall that's related to your knee joint, you go through a proper physical examination. Hence, it's very much important that you see an orthopedic surgeon. Let them know about the history of fall, the mechanism of fall. Let him do the diagnosis of your knee joint injury. Based on the diagnosis, doctor comes up with different treatment protocol depending on to what extent the injury has happened. There are certain diagnostic tests which are also prescribed in order to diagnose this problem. These tests are X-ray, MRI scan, ultrasound, arthroscopy, etc. Now, treatment usually comprises of painkillers or else say non-steroidal anti-inflammatory drugs, RICE regime, which stands for rest, ice, compression and elevation for few days, followed by wearing of a knee brace in order to provide external support to the knee joint while walking or else doing weight-bearing activities. Even if the tear is not much or else it's just the sprain, then physiotherapy is very helpful. Especially electrotherapy modalities along with exercise therapy is more than enough for a patient to get recovered from posterior cruciate ligament injury. But definitely in the cases where the tear is much more, then surgical intervention is required, which is followed up by a post-surgical rehabilitation or else post-surgical exercise program. So friends, this was a brief introduction or else say information about posterior cruciate ligament injury, which is very common in people who are involved in sports-based activity or else who have falls. So if you found this information helpful, make sure to like this video. Share this video with your friends and family members. If you have got any questions related to any of these topics that we discuss on our channel, make sure to put it in the comment section below. On that note, I will see you in another video. Thank you.